Kumar, Chief Clinical Officer for Hartford Healthcare. We'll start with our regular briefing and inform you of some of the things happening around the Hartford Healthcare. So we have 40 patients who are positive with COVID admitted across the Hartford Healthcare entities. Our Bacchus Hospital has 2 patients. Charlotte Hungerford has 2 patients. Hartford Hospital has 19 patients. Mid-Sid Medical Center has 2 patients. St. Vincent Medical Center has 8 patients. Hospital Center Connecticut has 6 patients. And Wyndham Hospital has 1 patient. That's a total of 40 patients across the acute facility. We also have 86 patients in community network managed in home care and nursing home, very few nursing home areas. A behavioral health network does not have any patients today. It's an important number today. It's this is one of the lowest number we have seen in several weeks in Hartford Healthcare. This is compounded with almost about 68,000 testing we have done across the Hartford Healthcare, 185,000 virtual visits, making sure we remain connected with the community. Obviously, we continue to monitor this activity very well. We are noticing our individuals are coming back to the emergency room, and other essential surgeries are happening across the Hartford Healthcare. There's a feeling of somewhat normalcy at this time, which is a wonderful thing. We still cannot let our guards down. We still have more than 42,000 cases across the state of Connecticut with over 4,100 deaths, which is still a staggering number for us to keep an eye on. One of the important milestones today is that the Hartford Healthcare is making today. The Hartford Hospital has had this tent between the CCMC and Hartford Hospital facility. This tent was erected during the height of the crisis, and at that time it would have served as a mass casualty scenario or place for triage. It's an extended space for Hartford Hospital. Thank goodness we never had to use this tent, but it was remained an important symbol to remind all our employees, all the colleagues who are visiting over there, that Hartford Hospital is prepared and ready to do what needs to be done in case that there's a need. For several weeks, this tent has really reminded us of the crisis our community has been facing as well. So today at 11 o'clock, this tent will be taken down. That's a symbol, that's a sign of somewhat coming back to the normal working environment. And we're so proud for our teams to be able to really act so quickly and create space for extension for our emergency room. And now today's the day we're going to be taking this down. It's a nice reminder for our success at this time, and where we're positioned with the COVID fight. If there's a need in future, we will bring the tents back, and obviously we remain committed to mobilize this very quickly if it's required. Our hospitals across the ED and the rest of the system continues to take the precautions of separate triaging and making sure we test all colleagues and test all the members across the system. Our visitor policy is relaxed as of today across the system, including the emergency rooms as well, allowing one visitor to be with a patient in times of need. So we are very, very proud of where we are right now in Hartford Healthcare. So another big movement coming up is Hartford Healthcare's COVID testing at the First Cathedral Church, 1151 Blue Hills Avenue and Bloomfields. That will be happening tomorrow. This is a collaboration between Hartford Healthcare, TFC, Rehoboth Church, and Bloomfield Congregational Church. The testing will happen from 2 to 7 p.m. And 2 to 4 p.m. drive-through testing designated for seniors and those physically impaired as well. So Hartford Healthcare continues to show the commitment towards underserved, towards the area where access could be difficult to get the testing done, and will continue to provide the services at this time. So there's a fair amount of activities happening across the Hartford Healthcare at this time, and we are still keeping an eye on the number of cases across the state of Connecticut very closely. We continue to test our employees at this time with PCR. We are still making sure that we select the random sample of healthcare workers and test them to make sure that they remain we remain on guard with this COVID. Lately, there has been an increased discussion about biases in our society, biases in the healthcare space. And we've been getting these questions about how do you manage, how do you understand, how do you train our colleagues to manage that part here. And we're fortunate to have a tremendous amount of knowledge and capability within Hartford Healthcare. One of the individual is one of my colleagues, Hin-McCormick. She's a clinical director for adult residential services at Rushford for Hartford Healthcare. Moima is going to address some of those topics and talk about her understanding on the bias at this time. Moima, it's all yours.
Thank you so much, Dr. Kumar.
Thank you.
Once again, thank you for this great opportunity to be able to have this conversation and provide some information. So, there has been a lot of questions as to what is unconscious bias. Simply put, unconscious bias, also known as implicit bias, is a prejudice that we act upon without realizing it. So we're making decisions that are being based off of prejudice, prejudgments, stereotypes, and it is being directed towards a group of people or an individual, and it could be a positive or a negative thing. Some of the things that Hartford Healthcare has been able to do, which I've been very proud of, working for Rushford and Hartford Healthcare, we were able to create a diversity, equity, inclusion committee. Our colleagues over at the Institute of Living also have a diversity, equity, inclusive committee as well. And both of our entities or agencies have been able to offer courageous conversations or let's talk sessions for staff. So what these sessions are is, courageous conversation is one of our H3W leadership behaviors. And Let's Talk sessions are being offered over at the IOL. This is a platform for staff to be able to just share, listen, learn from each other, and have a safe space to be able to just be together during these difficult times. Some points that I definitely want to put out there is we all have unconscious bias. This does not make us a bad person. It's really more about us understanding where this unconscious bias is from and how and what we do with those learning opportunities. And it's also trying to identify the potential impact that it would have on our decision making. So it's really about, self-reflection, broadening your viewpoints. Unconscious bias is taught and learned. We really, start learning about biases from childhood in the school systems, through media, playground, social activities, professional activities, what you're exposed to, what you're not exposed to. So it really is about trying to broaden our network and be more inclusive of other people. If we don't understand a community or culture, we really should try to explore that a little bit more and take some time to be able to learn more about that community or culture. It's also about asking those curious questions, another leadership behavior that we have at Hartford Healthcare. When you hear a colleague or a peer mention something or talk about something that really may not sit well with you, it's having a courageous conversation and not being judgmental, and it is really about respecting separate realities as well. Thank you, Dr. Kumar. I'll hand it back over to you.
Thank you, Moima. I appreciate that. I think it's important to have these kind of conversations within any setting, especially in the healthcare setting when we are here to serve all, and obviously we need to work together in that fashion. So having that expertise and the discussion and dialogue in a very safe space is a critical work for our organization. So thank you very much for leading that effort, Moima. At this time, I'll open for any questions for myself or Moima. Happy to discuss anything we talked about or didn't talk about today.
Good morning. It's Bridget at the Republican American.
Hi, Bridget.
Good morning. I'm just wondering, to kind of back up a second here, where and for what purpose is that bias training in place for? Is it for just a societal thing, or is it for healthcare?
Moima?
At the moment, we are making a strong effort to be able to train our staff and really support our staff. I think the training really has to be a larger picture. It can't just be, exclusive to your professional settings. It really needs to be professional and personal as well. Dr. Kumar, I don't know if you wanted to add anything with that.
I think in healthcare, keeping an open eye on the biases is always very important. I think we are here to serve all, and the healthcare system is very complex as well. Having that kind of conversation and talking about the biases is extremely important. We continue to pay attention to that. We continue to make sure our colleagues are trained and understand the complexity around this topic. As you know, the biases don't generate from the birth. They come from the societal and learned experience over the time. And as we work in a melting pot of different diversity in one area, having that dialogue, having the awareness is very important to be able to do the right thing for the community and for ourselves. And the reason to mention this particular piece is so important right now is because we want to make sure that the community understands where the healthcare system works, especially the Hartford healthcare. We keep an eye on all these factors, all these facets of our lives, and that positions us differently, that positions us more open and more vulnerable at times to be able to talk about these things. So at this time, it's a colleague-oriented, it's oriented to our staff, but that's an important conversation to have for us with you and everybody at this time.
Yes, I understand that. Could you perhaps give me an example of the kind of situation that would deserve this kind of training?
Moy, please add on to after my comment. It's not a situation which we're reacting to. It's more of a proactive approach. So we understand that, and we prepare ourselves in a way that our care process, our interactions within the teams remain optimal at all the time.
Yeah, and I think to add to that as well too is, we work with diverse populations for all of our sites under Hartford Healthcare. In order for us to really provide the best service possible, we need to understand our communities and the various cultures that they represent as well. So I think being able to prepare staff regarding unconscious bias and other things will also allow them to provide better service to the communities that they're working with.
Okay, thank you.
I think, Bridget, it just goes to show our preparedness in a multidimensional society we live in, and as a healthcare system needs to prepare themselves for all aspects of care, and not only just as great science and technology, but cultural components, understanding the community we serve, the place we live, and how do we make sure our colleagues remain open to that as well. So it's more of a proactive, it's a training-based approach, and these things becomes extremely important, especially in the times like COVID, especially in times of stress, quite frankly. And we've seen that as we're learning right now, there's a disproportionately higher mortality and risk to some segment of the population, especially when situations like COVID emerges.
Thank you, Dr. Kumar.
Very good. Looks like we don't have any other questions. Tina, do you have anything on the Facebook?
Nothing on Facebook today.
Very good. Well, I want to thank everybody for being here, and I appreciate your expertise, and thank you for all the good work you do for the Hartford Healthcare and your team. And this is a critical piece of work your team takes on, so I'm deeply appreciative of that.
Thank you so much for the opportunity.
Thank you. Thank you, everybody.